Hello, I was tweeting about healthcare marketers, and Advertising Health replied to me saying that why can't I do an article on healthcare marketers and what should they know about doctors or healthcare practitioners or whatever healthcare marketers need to know. So I thought I'll do this. Healthcare marketers today encompasses a large number of people. Traditionally, it was the pharma marketers and marketers who were doing surgicals, who were doing implants, who were doing vaccines, and today with the digital age, there are a lot more platforms coming up. There are a lot more enabling tech enabling doctor patient relationship that is coming up. So all of them trying to market their products and services. So the whole of healthcare marketing looks wonderful, but at the same time, that means newer and newer people are coming into healthcare. So my advice to them is always understand healthcare as a domain before you market your product, and I'm sharing a few views about it. Healthcare marketers should understand healthcare as a golden triangle. On one side is the patient, on another side is the healthcare providers, on the third side is the healthcare companies who has products and services for the patient, for the benefit of the patient. If a healthcare marketer understands this golden triangle and then knows the weightage of all three and works with this perspective, he can go a long way contributing to healthcare as such. A lot of tech enablers for doctor-patient relationship are coming out with products and services. A lot of them approach me uh, asking about healthcare marketing. So here is a huge opportunity, and new people are coming into the healthcare environment as healthcare marketers. Healthcare marketers need to know doctor as a customer, healthcare practitioner as a customer. There are various markets, various models of healthcare practice, various regulatory agencies, various types of approach, but healthcare marketers need to understand doctor as a customer and what they do with their patients. Though healthcare as such is practiced differently in different markets, there is a commonality, there is a huge commonality. The commonality is the patient. If we have to list out the commonality from the patient's angle, there is a huge commonality. And one of the commonalities is patients depend on healthcare practitioners and they go by their endorsement. Healthcare marketers need to understand four basic things. One is the doctor's classification. The doctors can be classified into various groups. I'm not meaning the specialty, I'll explain that. Second is focus on the patient. Healthcare marketers need to know what is the meaning of focusing on the patient. By and large, it involves the doctor-patient, understanding the doctor-patient relationship and contributing to that. And the third thing that they need to understand is whatever they do have to be endorsed by real doctors, real practicing doctors. And the fourth thing that they have to understand is the underlying changes that technology and social, I mean the social media or the social business that is bringing in the behavior of the customer, patient as a customer or doctor as a customer, and the whole underlying changes in healthcare due to this technology and social revolution. I always say healthcare marketers should know one important thing, that is classification of doctors. Basically, a doctor goes through four stages in their life. One is when they are academically equipped, when they get their degree and they come out, they are under the influence of their HODs, their school of thought, but they still have not handled outside patients, have not gone out and have tried out whatever they have learnt. This situation, generally pharma marketers ignore them, but I would say that it's very, very important you go and talk to them, not about your products and services, but you talk to them about your corporate company, about your industry, how it is regulated, what do you do, why do you do, how do you do, kind of thing. They will have a lot of time, they will appreciate, because they are also learning about the industry, they are also learning about how a corporate company functions. So that stage is very, very important to establish a relationship with those doctors and we used to call them catch them young. And then the second classification comes, the doctor has gone out and has put up his own practice or joined a new hospital. Now here, though he is under the influence of what he learned, the school of thought or the influences, he still has the liberty now to try his own judgment. So I would say this is the time you go and introduce the products, services. He will give you a lot of time because he has time, he's not that busy, and he will listen to you, probably ask you a lot of questions so you can understand your own products and services better. So this is the second classification. The third classification of doctors are the peak practicing doctors. Actually, they are the ones, the whole healthcare marketing, whole pharma marketing targets. They are very, very important because their prescriptions are going to make the sale. Their prescriptions, their endorsements are going to matter. But here, they don't have time. So if you have developed in the first two stages, had been with them, have established a relationship, it's easy. Now you minimize the time that you spend with him, be highly sensitive to what he needs, and then I would say that keep channels open for him to reach you rather than you go bombard and waste his time. So if you subtly handle, there are chances that those doctors are going to support you left, right, and center. And then the fourth category of doctors who have had their roaring practice, they have become seniors. Those are the kind of doctors you should invite them as speakers, listen to them more, and then network with them in such a way, because whatever they are going to say is going to be picked up by the market, and maybe a retired professor of any discipline, there will be thousands of doctors who would look forward to him and follow him. So these are the four classification of doctors that healthcare marketers should understand, and not think one is important or other is important. Spend equal time. See, that way you are also not too stressed. You get time to talk about your company, to talk about your, so all kinds of knowledge is useful to be shared with these doctors. This a healthcare marketer must know. Healthcare marketers should focus on the patient. Even if they are operating through the healthcare practitioner and contributing, they have to understand the complexity of patient management with respect to a healthcare practitioner. I generally say, help them to help you. See, 3-4 things that are very important. One is, research shows that 80% of the time when the patient comes back from a doctor visit, they do not remember anything that the doctor advised them or told them. Even if they remember, 50% of that they have got it wrong. This is number one. Number two is, they have other sources. Today in this digital age, they go through Google, they go through other patients' experiences of what they underwent. So the other sources, they come with all that, and the healthcare practitioner has to deal with that. Number two. Number three is, what the patient know, what they know includes their emotions, fears, apprehensions, hearsays, everything. So that has to be dealt with. And then the compliance factor. The biggest challenge for a healthcare practitioner or in the patient relationship is the compliance factor. And the last thing is the time factor. The healthcare practitioner does not have time, adequate time to spend with the patient. So as a healthcare marketer, how can I address these things and help the healthcare practitioner or help the patient? This would determine by and large how successful I am in healthcare marketing. Healthcare marketers should understand the underlying changes in the digital age. That is the compliance factor. As I spoke big about it, there are huge opportunities to solve this by way of wearable devices, by way of patients sharing their details, that motivating the whole ecosystem. So what are the underlying changes today technology and social can give us to attend to this compliance problem? If a healthcare marketer picks up this area, I think they can win by huge miles. Healthcare marketers ask me, what are the top 3 things that I would consider very, very important for them to learn? I would say number 1 is focus on the patient. Number 2 is learn to classify the healthcare practitioners. And number 3 is learn the underlying changes with technology and social. If there is one single thing that I wish that healthcare marketers learn around the world, is that the first thing that they should learn is the complexity of patient management in real scenarios, not by hearsay, They have to sit with healthcare practitioners and try to understand how they really deal with patients in the real world scenario. This will go a long, long way. Being in healthcare, having a successful product or service, and then winning and also contributing to healthcare.